The area of health, we said all of our families should have affordable health care. It's a shame that 45 million people in this nation, 45 million people are not covered with health care. Leading our charge is our doctor, Dr. Hernandez, member of the State Assembly, a very successful doctor, private businessman in his own community, has invested countless amounts of dollars in providing free vision care services for low-income kids in our community, and he's going to lead the charge in the area of education. Mr. Dr. Hernandez, please. In health, actually, right?
Good afternoon, everyone, and of course I'd also like to congratulate and thank our leader, Assemblymember Coto, as well as our vice chair, Assemblymember Cedillo, and by the way, Gil Cedillo is one of my patients as well. Kevin De Leon. Yeah. And he wants to be a patient. You know, the last time that we had a serious discussion about health care was during the Clinton administration. And it's unfortunate that at the national level, we could not address that concern. But I'm not excited. I am ecstatic to know that the state of California is on the verge of taking a leadership role in this country to addressing the uninsured, not only in the state of California, but I also think in the nation. And the time has come for us to do that. What I want to do is I want to just tell you from a provider standpoint the frustrations that I see every single day practicing in a predominantly Latino community and the problems with access that we have. Here's what I see. Number one is we have very few professionals that graduate as healthcare providers. And I think it kind of goes back to what Assemblymember De Leon mentioned. We have very few Latinos going into, first of all, graduating from college and then going on to a graduate level to become a provider, whether it be a physician, dentist, podiatrist, chiropractor, nurse practitioner. To me, that's extremely essential and important because it is those individuals, like myself, who have a higher tendency to go back to the communities that they were raised, brought up in, and want to serve. Because I think it is that individual that has the unique perspective of understanding the culture, speaking Spanish, and is willing to give back to the community. That's the big problem. The second problem that I see as a provider is, number one, in the areas or the communities of color, predominantly Latino, you have very few providers who go there. They don't go there because of the poor reimbursement rates that we get from the state of California with regards to Medi-Cal. They don't go there because of the lack of specialists that they can refer to that I see to every single day. Finding a retina specialist for me to refer to, or finding a neurologist or a cardiologist who will accept Medi-Cal and the individuals who have the most need is like pulling teeth. It's extremely difficult to find an individual. So these are the frustrations that I see as a provider that translate our communities and the access. But most important, the biggest problem we have is access to health care for the most neediest patients in our state. Let me tell you that we have a condition that's not only what I consider in epidemic levels, and that's diabetes, that affects the Latino community in great numbers, that can cause primarily problems with the eyes, the feet, the heart. It causes a lot of complications, and a lot of the individuals that have those conditions don't have access to health care. So I, as well as the Latino Caucus, is committed to providing universal health care for all of California. And I'm just going to read a couple bullet points that we have taken a position on that we're going to be addressing. The Latino Caucus is at the forefront of health for female students so that at an early age they may be protected from insidious diseases derived from the human papillary virus, the HPV. The Latino Caucus has a responsibility to protect the public from harmful products and is committed to to eliminating artificial trans fat foods so you can restaurants and supermarkets. And that's our colleague right here, Assemblymember Mendoza. The Latino Caucus wants to promote a healthy lifestyle, protecting our children from cigarette smoke by prohibiting smoking in vehicles with minor passengers. And the health agenda for the Latino Caucus includes ensuring Californians eat leafy green vegetables that are healthy and safe. So in conclusion, I want to thank you for allowing me the opportunity to speak, and it's an honor to be the lead person for the Latino Caucus, and I hope that at the next conference, at the end of this legislative session, I can say that we've addressed the problem to the uninsured in the state of California. Thank you very much.